So you don't get in trouble with the doctor, because if you ask the doctor, hey, I want to get this test, they get all huffy and puffy and they want to do it. But things that you can do is, one is it's called a CBC. And a CBC means complete blood count. And what you can do is you look at the white blood cells specifically, WBC, you look at the MCV, and you can look at something called RDW. And what those three numbers tell you is, if the white blood cell count is really low, you have to be concerned. If the white blood cell is too high, and if you want numbers, I'll give you the numbers. Your white blood cell count less than 4 or higher than 15, then there's something going on. Might be overtraining, might be whatever, infection or something like that. MCV is mean corpuscular volume. That tells me how big the cells are. So, for example, a lot of people that come to the office that are vegetarians, and any vegetarians here? I hate them anyway, but that's okay. They will have issues. If the MCV is more than 93, something is going on. Less than 82, something is going on. Okay? And finally, the RDW tells me in that same way, if they're small or big, what's going on. Is it low iron? Is it low B12? So you can identify low iron or low B12. Now, the most common well-known, I'm sure that you heard of this one, is testosterone levels, right? The only problem is that testosterone levels can vary for so much. Are you married or not?
Engaged.
Engaged. Okay, those testosterone levels are going to drop in a few years. Well, actually, they have done research in which when you're married for 7 years or more, testosterone levels drop. And I don't know if you guys heard this, the 7-year itch of marriage. It is actually true, because what happens is, as the longer you stay married, the lower your testosterone levels become. And the reason is you get comfortable, you get used to your partner, and the hunting drive goes away. And that's why at 7 years you start having the ups and downs in your testosterone levels, and that's when you either go have an affair or screw up, or you say, no, I'm going to stay with this person. Are testosterone levels a good indication of overtraining? Absolutely not. But if you look at testosterone cortisol ratio, you might be able to have an idea where you are. I prefer a urine test more than anything else. If I was going to do that and compare that. You can also look at sodium and potassium. And this is everybody does this. And people are not aware of that. When they look at sodium and potassium, if the ratio is less than 30, you're usually overtraining or you're stressed. So that's easy. Everybody does this test, sodium and potassium. It's called a Chem 7. So you can calculate dividing sodium and potassium less than 30, your adrenal glands, you're overstressed a little bit. Okay? Now, for you guys to know, the most or best way to tell a person is by history. You know, because some people are overtraining, some people are not sleeping, some people are having an issue with the relationship. So I got to look at all that. When you guys are training somebody, I know that you guys sometimes tend to look at what they're doing on the gym, and you cannot look at what they're doing on the gym because the gym is only an hour of the whole damn day. So, and I know I have a lot of trainers in my office that will come and say, well, I'm not overtraining my client, but I'm going to show you guys something here real quick.
What do you need?
Eraser. You have a piece of...
Did you bring it?
Thank you, sir. If you guys have a person in your gym and you say, oh, I'm not overtraining my person, you know, we're doing this or that, you guys got to be careful because I'm going to teach you what I deal with. And I'm going to put stressors here that you can say, okay, there is... Entonces, this is going to be a better answer instead of looking at the blood test. There are genetic stress, there are mutations, like MTHFR. Are you guys heard of the MTHFR gene or not? You guys heard of that? MTHFR is when your B12 and your folate levels are really important for DNA. And when it's not working properly, that's a mutation that will actually prevent you from recovering. Physical, and I know you guys think about physical only about physical abuse and physical abuse, but you're a mover, right? What do you have to do for a living?
Pick stuff up and put it down.
Pick it up and move it. Well, that is a form of training, and then you take him and you make him train 5 days a week, he's not going to grow because he's training at the gym, plus he's training at his work. So this is a guy, how old are you now? 29. I would not work out more than 4 times a week on this guy. Why? Because he does a living lifting. So me making him lift more, it's going to overtrain him. You see what I'm saying? So you have to look at that chemical. Most people saying chemical, well, there are chemicals that are toxins, like lead, mercury, sugar, okay, but also diet is a stress. Also, you have a client that is taking drugs, statins, or anti-cholesterol medication, that's another stress. And when people are taking statins, do worse on training. So you have a person that is taking statins, and I know you guys see older population, back off because the statin don't let them recover appropriately, and they get sore more often. So I just want to tell you guys, average person on statin requires 4 to 5 days to recover. Not because you overtrain them, it's because the medication makes it that way. Environment, okay? For example, I have a guy that is a swimmer. He swims, he does triathlons, but he also works in a swimming pool, cleaning a swimming pool. Well, he has to do with chemicals all the time, so I got to be aware of that. Also, these lights right here suck, but these are the commercial lights, right? So you have to be very aware that those will affect you, vitamin and stuff like that. Religious, if you are a person that feels guilt, if you are a priest, and I have priests in my office, if you are a teacher that has to show certain behaviors, that's actually stress. Social, emotional, are you dating? Are you going to get married? Are you getting divorced? Is your child sick? All those things affect the training in the gym. So you guys got to, when you have a trainer, how you doing today? When you train a client, how you doing today? How's life? Just ask open-ended questions because they can tell, I had a shitty day today. So that day you might not back off the training and just, we're just going to do 2 sets or take it easy. Okay? And the last one is economical. I cannot pay Austin to treat me. I cannot pay somebody, So in those cases, you might say, well, you know what, give me $5 today. We train you, you enjoy it, come back. So you have ways to deal with that. Or it's Christmas time, I'm going to give you a free training session. Those are things that you guys can be able to deal with that. So that gives you a bigger picture of where you are with your clients. If you have access to whatever you want, one of the biggest markers is something called glutamine to glutamic acid ratio. And it has to be 6:1 in the blood. But not many people have access to that. So that is a true, if the glutamic acid ratio is less than 6:1, you're overtraining that client. Okay? Any questions about that? Okay? Questions, Mr. Mover? You have any questions?
Not this time.
Teacher, you have any questions?
Yeah, I have a specific question that hopefully
Yes, sir.
broad for everyone to benefit from it. Austin,